Yes, welcome to Home-Based Medical Services Television in partnership with Masaka Home-Based Medical Services International, a body that is responsible for making sure that you can access medical attention while you're at home. That is Masaka Home-Based Medical Services International. But more importantly, I also want to welcome you to HBMS TV Talking Health, a channel that is devoted to health educating you on how you can live a healthier life. These programs are proudly sponsored by Mitiana Institute of Nursing, the best institution as we talk of now, that trains nurses and midwives and laboratory technologists. So basically, today we are getting into our first aid series, part 3. We had part 1, it was awesome. We had part 2, and now we are getting to part 3. And when we talk about first aid, just that is the medical attention that somebody gets immediately after they've gotten an accident. And it should be a golden hour. The earlier you consider a condition and take it serious, the better. That is why we feel like giving you the basic knowledge that you need to make sure that you help people who get accidents. So today in series part 3, we are going to be looking at the general examination of the patient. And I want to bring you to your notes, who is following us at HBMS TV. Don't forget to subscribe, that it is necessary to perform a quick and efficient examination of the patient to diagnose his or her condition and give prompt first aid. So the history may be obtained either from the patient, him or herself. It can be obtained from the onlookers, or even from the patient, that is if who is conscious. But if the patient is not conscious, you can be getting the information from the onlookers. The complaints, I want to bring to your notice that the complaints of the patient are taken as a clue to the nature of the injury that one has sustained. So you must be very keen when you're dealing with the casualties. And more importantly, you need to know these few things. For example, pulse. Note the pulse of its rate. Then you look at the rhythm, then the volume, then the tension, and more importantly, you also need to look at breathing. Note if the breathing is slow, or it is fast, or it is absent, or even the casualty is gasping. You need to note that very well. Then we look at pallor. Note pallor, the degree of whiteness of the tongue, the conjunctiva, the nails. This indicates the severity of bleeding. That is if the patient or the casualty is bleeding. So blueness of the tongue, lips, then the earlobe, and then the nails indicates lack of oxygen. So you must be keen about that. Yes, as Africans, you may not be in position to see the blue earlobe, the blue skin and all that, but more importantly, for those of you who are going to leave Uganda and go and work abroad in the white, you need to take note of these things. But you need also to consider that breathing from any part of the body should be taken serious. Then the other one is swellings, you need to consider. And now when we talk about the general examination, we have what we call head to toe examination, and that should be done. For example, we have what we call the head. When it comes to the head, you need to observe the skin color. Is there any wound? Is there any contusion? Let me say part of the head has sunk in. Then you talk about the facial symmetry. Then you need to assess the level of consciousness. Is the person you're dealing with conscious or not? Then the other one, assess the level of, you need to palpate for depression of the skull. Then you can talk about check the ears and the nose for fluid or blood. That is, if there is any discharge, then you need to check the mouth for bleeding or any body in the mouth. At times, people have dentures, those artificial teeth, it can come out and it is hanging, it is sagging. You must be in position to know that. Then when you go to the neck, you need to observe and palpate for the areas of tenderness. Tenderness is just pain. Then if there is any deformity, I remember let me tell you this, there is a guy who used to ride a motorcycle and he would put on a jacket facing backwards. So when he got an accident, when these people came to the scene, they said this person has been severely hurt to the extent that even the head has turned. You get the point, So you must be very keen, you as a first aider, to note such things. Is there any deformity? Is there any change? You must be keen about that. Now, The other most important thing are the arms, then the chest. And when you look at the arms of the patient who you want to help, palpate the entire length for pain. Is there any pain? Then wounds. Look for deformity and sensation. Then you can even ask about pain, then the tingling, then the numbness, and then the movement. Can this person move their arm very comfortably? Can they turn their arm comfortably? You need to know that as a first aider. And when we go to the chest, palpate the clavicles and then the shoulder, observe for wounds and whether the chest expands normally upon inspiration and expiration. You need to understand all those movements as a first aider. Then you also need to press gently on the sternum and the ribs to check rigidity and the pain. That is just, we are giving you the basic knowledge that you need to be a very good first aider. And then we can talk about the abdomen and the pelvis. You need to observe for distension of the stomach, even all wounds. If the wounds, then you also palpate for rigidity and tenderness that is around that area. Then when we talk about the pelvis, palpate the iliac crest, then the pubis for pain, then observe for incontinence of the bladder and bowel. Can this person contain urine? Or urine is just passing out, fecal matter is just passing out. You must be in position to observe that very well. And then the other one, we have the spine and the legs. General examination from head to toe. When you look at the spine, we have the cervical spine, the thoracic spine, the lumbar spine, and then before you go to the lower limbs, you need to palpate for tenderness around that area, wounds and deformity. Then when you look at the legs, you palpate the entire length for pain. You can look at deformity, you can look at wounds, you can look at cessation, ask about pain, the tingling and the numbness. All these things should be done to make sure that you know who you're dealing with and what condition they are going through. And now, what are the treatment of first aid goals? What should be your goal? You, somebody who has been part of our series part 1, part 2, part 3. Very soon we will be coming with series part 4. What should be your goal? Number 1 is to preserve life as a first aider. Maintain a clear airway by positioning casualty correctly. We will be health educating you about that. Then begin resuscitation if there is no pulse and respiration. Then more importantly, you need also to control bleeding. That is your preserving life. Then the other one is to prevent the condition from worsening. Dress the wounds very well, then immobilize the fractures, treat patient in correct position. That is about preventing the condition from worsening. And then the other one is to promote recovery. Reassure the casualty and relieve anxiety and fear. Relieve pain and discomfort. Handle casualty gently. Protect casualty from cold and wetness. All these should be your goals as a first aider. I want to end by saying that congratulations to our beautiful institution, that is Michigan Institute of Nursing, who make sure that these programs can also come to you. But if you're out there and you're a healthy institution and you would want to promote these programs, you would want to be part of our shows, you're highly welcome. You just need to contact us through the numbers at HBMS TV, and we can be in position to do business with you and help you promote your institution. Thank you very much, and may God bless you. Those are the first aid or treatment goals. HBMS TV, talking health.